In this presentation, I will talk about the cementation of a fixed prosthesis step-by-step procedure. Before the patient comes, you should check your restorations on the die, and you should first check the shape of the restoration, the color and shade of the restoration, and then you should check the fit of the restoration on the die. You should first check the interproximal fitting of the restoration, then the internal surface fitting of the restoration, then the marginal fitting of the restoration, and finally the occlusion of the restoration. When the patient comes, you should make a quick review for the dental and medical histories of the patient and do anesthesia if necessary, and then remove the provisional restoration and clean the tooth with an intracoronal brush so that the restoration can be fit on a cleaned area. After that, check everything again. We should check the interproximals, then the internal surface, then the margins, then the occlusion. Here I would like to indicate that I will make a separate video about how to check these four things separately, but in general and at a glance, the interproximal areas will be checked by putting an articulating paper between the restoration and the adjacent tooth, and then pulling the articulating paper. If that articulating paper can be pulled easily, that means the interproximal areas are fine and good. If it if 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 you would face a difficulty during the pulling of the articulating paper from between these two surfaces, that means there is an excessive height of contour at that interproximal area that should be adjusted accordingly. After that, we check the internal surfaces for any high spots, and that is done by the use of a material that is called as a fit checker. It checks the correct fitting of the restoration. It has multiple shapes and forms, and I will talk about them later, but they generally disclose the high spot that is present in the internal surface of the restoration, and then we can adjust that accordingly. After that, we check the margins of the restoration, and that is generally done by inspection or the use of palpation with the help of a dental explorer. Finally, we check occlusion by the use again of the articulating paper and check if there are some, at least let's say two contacts on the foci or on the marginal ridges, and that will be possibly and mostly the correct occlusion. After that, we mix the cement according to the manufacturer's instructions and fit it correctly in its place, and then ask the patient to bite on a cutter rule until the complete set of the material. After that, we remove the excess cement by the use of a dental explorer, and then we check again, and this is for the third time. The first time we check the restoration on the die, the second time we check the restoration on the tooth but without cementation, and this is the third time we check the restoration on the tooth with the cement present beneath it. Now we will check the margins. After the cementation, we check the margins only by inspection and palpation using a dental probe, and we check the occlusion by the use of the articulating paper, again as I have said before. Then we instruct the patient not to eat or drink on that area as specified by the manufacturer. Okay, so that it is important to read the manufacturer's instructions for the materials that we use in our clinic. Thank you for improving yourself by listening to this presentation. Always try to know, always try to spread that knowledge, and so that you will construct the world. Always try to be kind to others because life is not short but it is limited, and that is for the greatest benefit to the humankind.